it helped me shift my thinking from, okay, I failed at a home birth, to I succeeded in bringing my son where like he was supposed to be. And he was supposed to be at this Palestinian hospital in the middle of a war in the NICU with no kosher food.
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast. Welcome to another episode of the Happy Birthway Podcast. Friends, I hope that you are all doing well and getting ready to hunker down for the winter. For those of you living in areas where winter is fast approaching, I cannot believe that it's already November and that there are menorahs and dreidels being sold in the stores right now. And if you would please rate and review this podcast if you are enjoying it, and if you would please share it with just one friend, and subscribe or follow on whichever app you are listening to. It really means a lot to me when you do so. I read every single review, and it just fuels me to continue doing this work. It's such a huge passion of mine. Sometimes it can get a little discouraging when I see other podcasts like topping the charts and they barely just launched. Granted, most of them are launched by some famous people with other platforms, but I'm really trying to get more exposure and get it out there and help more people and allow more people to enjoy and gain from what this podcast has to offer. So please, I appeal to you to rate and review. And you can only do that on Apple Podcasts, not on any other platforms. And even if you listen to this podcast on other platforms like Spotify, Google Podcasts, whatever it may be, if you have an Apple account, if you can just quickly drop by over there and even just rate it, like just hit the 5 stars. Fewer stars if you truly believe that there's any way that I can improve. And if that's so, then please put that down in the review. I read the reviews, so I would love to know what your opinions are. And with that said, today, I am so excited to introduce to you Simcha Shar, and we are going to listen to her birth story. She has one sweet little baby boy. I found her on Instagram toward the beginning of when I started my account, and I just love following her and her just personal journey, diary. And you have such beauty and so many beautiful thoughts and values that I love so much. And we connected a little bit over Instagram, and it was just so beautiful to follow your journey into having your first baby. Before we start the interview, I wanted to let you know about a great new course for preteen girls called Girls Growing Up. Let's be real, many mothers have a hard time talking to their daughters about puberty. Well, Dr. Alyssa Hellman, who's a girl mom and an Orthodox gynecologist, has you covered. She designed this course, which is designed to be understood by preteen girls and watched with or without their mothers. It covers the Torah perspective, anatomy definitions and diagrams with helpful explanations to prepare young girls for the changes of puberty, all in an easy-to-understand, comfortable way. You can sign up at theconfidentkala.com or through Dr. Hellman's Instagram page at theconfidentkala. So welcome to the show, Simcha.
Yay, thank you so much.
And on Instagram, you are a gentle Jew.
Try to be gentle.
Yes, you are definitely very calming and serene. So let's have you start where you feel is the beginning of your birth journey. For some people, that's getting pregnant. For other people, it's even before that.
Wow. I'm so honored to be here, and I feel like just very mishamayim, very hashgacha pratis to have this. I don't think I've shared with anyone much about my birth story or my pregnancy experience or my postpartum experience, and I know how important it is for me to talk about it, and this is kind of a kick in the butt to do it, so I'm really excited.
Yeah.
This pregnancy started in a really scary place for me. It was on Rosh Hashanah, and I was staying, it was the middle of COVID, and I was staying in my parents' extra space with my husband because we'd sold our house and we were desperately trying to get back into Israel. And I was having the worst period pain I've ever had. And I said to my husband, it's not that I'm not uncomfortable. I'm very comfortable with pain. I just want to know what this is. And I was really freaked out. And I went to the doctor right afterwards because it was right after Rosh Hashanah. I took a bunch of Advil. And I arrived at the doctor's and they said, "Is there any chance you're pregnant?" And I said no, because I was not trying to get pregnant. And they did a test anyway. And the nurse came out. I was sitting in a waiting room with a bunch of people, and she bent down next to me and said, "Come back with me." And she was so gentle. She was such a messenger. I was so vulnerable in that moment. I was in a lot of pain. And she said, "You're pregnant and you need to get a ultrasound right away because we think it's an ectopic pregnancy and that's why you're in so much pain." And so if you've ever met me, most classic simcha, my phone was dead. And so I couldn't even reach out to my husband. And I was just crumbling. I was a mess. And I asked the front desk if I could use their phone. And they were so kind to me. And they said yes. And my husband came and I was just in tears. I was embarrassed. And I was really scared. I did not know what ectopic pregnancy meant. It sounded scary. I did not know what it to think about feeling pregnant. And so then, after hearing that I was pregnant and it might be ectopic, I went to the hospital. It was a pretty bad experience. They refused to tell me if it was ectopic or not because they weren't my doctor. They just like hid behind some bureaucratic thing. And
Yeah.
and I was so overwhelmed, and it was so early in the pregnancy that they couldn't even tell me anything. They were like, "We don't see anything, but you are pregnant." So medically, I was just confused, and scared.
So to backtrack, an ectopic pregnancy, did they explain to you what that was?
They said it's like when your pregnancy gets in a tube or something.
Right. So what happens is when the egg is fertilized by the sperm and turns into an embryo, there is some time it has to travel through what's called your fallopian tube, which is next to your ovary. It has to travel through that fallopian tube. So it's like a journey into your uterus. And the embryo needs to implant in your uterus. What happens with an ectopic pregnancy is that the embryo implants in the fallopian tube that it is traveling through. The reason why that's so scary and dangerous and life threatening is because the fallopian tube can get damaged and burst and infection. So it is an emergency situation. And one of the symptoms is cramping, like you were having. So I guess that was the first thing that they needed to rule out. And it's so hard with, like you said, these bureaucratic processes where you go get an ultrasound and the person that's doing it is an ultrasound tech, not a doctor. So they cannot even say anything, even though they know
Right.
a lot of times what's going on. So yeah, that's so hard. But they likely also saw on labs that you were pregnant, but it was probably way too early on in the game for them to even like see a heartbeat, is what I'm presuming.
Exactly. So I think I felt that sense of urgency and fear around what could be happening without a lot of education and a lot of sense of what the future looked like. I
Yeah,
left
it's
the
scary.
hospital. It was so scary. I left the hospital in tears, not knowing, am I pregnant? And that's one path for my mind and body to go on, or am I having an ectopic pregnancy, which is another path for my mind and body to go on. And I got a call from my doctor, and she said, "You're pregnant. It's not ectopic, and it's likely just implantation pain," which made sense because the pain was going away.
Oh, good. Yeah. Some people can
Yeah.
experience that. So what a shock. Like, so much
Oh
to
my
process at
God.
once. Not
I
only are you
know.
pregnant, but now they're not sure if you have some life-threatening something, and then they're not sure if you're even
Yes.
pregnant.
Yes, it was not an easy way to flow into pregnancy. And I had a rough pregnancy. I wrote about it on Instagram a lot afterward about how much pregnancy felt like an earth element. It was so slow and staying and never changing. And I'm a really fast moving, fiery person. So I found pregnancy very challenging. It was just a never ending slew of discomforts from nausea to not sleeping, whatever. It was not pleasant. And slowly throughout the pregnancy, it became more manageable. So halfway through my pregnancy, I moved to Israel and readjusting to a whole new medical system, trying to find a midwife. And the background here is that I'm a trained doula, and I really came into the birth experience from that. I'm not sure what the word for it, but like from that enlightened mentality about birth. This idea about birth, reading all the books, very peaceful, with a very specific philosophy around birth. One that is centered on a woman's power in birth.
So a positive experience versus some people know nothing about birth, or they just hear some horror stories. They hear
Yes.
their mothers, aunts, and women around them talk about how scary and painful it is, and they come in with that perspective. And you came in already knowing the process and having a very positive perspective around it.
Yes. And I think for many women coming from that traumatized view of birth, it's really important to get some of these positive messages. For me, I came in with so much sense of my own power in birth, and I think birth humbled me deeply.
Yeah.
Yeah. Yeah, I mean, I thought I could will my way through my birth. I thought I could breathe my way through my birth. I thought I could think my way through my birth or mantra my way through my birth. And Hashem really showed up. And there was this other element. It wasn't just me, it was also about the birth that I was gifted from Hashem. And it was very different than what I imagined it would be, and really humbled me and forced me to confront some of my conceptions about birth. I planned a home birth with a home birth midwife, and ultimately I ended up in a hospital and with my son in the NICU. So it was a really just not what I thought was going to happen.
Yeah.
Not what I thought was going to happen.
Yeah.
In some ways, for me, that preparation around birth was harmful because it created a specific image of what birth looked like. And that set me up to not listen to my inner voice. And she was really strong and clear. And she said, after 2 days of constant contractions and no progress and no sleep, I need to go to the hospital. I need relief. And it took another 12 hours to really listen to that inner voice. And that's like my only regret, is that it was clear for me that I wanted to be done and I had no koach left. And I just didn't listen to her. I allowed my image of what birth was supposed to be to kind of trump that inner voice. And I think I was shocked that that is what my inner voice said. I always expected her to say, "You can do it," or, whatever mantra. But she was right. She was right. I needed to go to the hospital.
Yeah. Wow. I think it's so important, like you're emphasizing, to have that view of birth in moderation. So while birth is positive, everyone needs to birth in a very unique way,
Mm-hmm.
and not set your expectations to be just exactly rigidly one way. My question to you is when you were having those contractions and that pain and discomfort for those 2 days, was your midwife involved at all in that?
She was very involved, and I really respect her and like think she's an amazing person. And I think I needed a different approach. Afterwards, I shared with another midwife friend of mine, and she said there's kind of this theory of midwifery, of home midwifery. There's like two theories. I don't know this. I don't know if this is true. But that like there's like a sit and knit theory where they kind of like sit on the couch and knit. I don't know if you've ever heard of this. And then there's like a more like proactive involved. And I think I needed more proactive involved. Like a few times I asked, what's going to happen next? Like, I need to know what's going to happen. And she was like, oh, it's so normal to want to know that. But I actually wanted her to tell me what was going to happen. Like, if you don't feel better in the next 2 hours, we're going to go to the hospital. Or if you don't get to X by this time, you know, I think I felt really lost and really overwhelmed. I was in a lot of pain for a lot of hours. And, you know, if I had given birth in those 2 days, I would have said, I had this amazing home birth experience. But that's not what happened. You know, I didn't give birth in those 2 days, and I needed to go to the hospital.
This really underlines the importance of vibing with whatever provider you have, and everyone has such a different need, but there is certainly a very important need for chemistry with your provider, and it's trial and error a lot of times. You know, so now that you've given birth once, you know what you need, and this is a message to anyone that's using a provider that just doesn't feel like they're the right chemistry for them, you know, to be able to look elsewhere.
Exactly. Yes. And I think this was really learning for me. Like, wow, it was just such a crazy experience. So we decided to go to the hospital. This drive to the hospital was like the worst hour of my life. I live in the middle of the West Bank. I live in Tekoa. And we were driving in the middle of a war in Israel. And it was all centered on this place called Sheikh Jarrah, right? Sheikh Jarrah. It was all over. It was trending on Twitter and on Instagram. And I was driving to Sheikh Jarrah to give birth in the Palestinian hospital because my water had broken a long time ago. And we knew this was a blessing of having a midwife. She knew that if we went to a certain hospital, they would have certain timelines around that water breaking, which totally makes sense. But this other hospital was a little more lenient, and unless I'd shown signs of infection, they would be willing to let me progress with a vaginal birth. And so we went to this Palestinian hospital. On the way, my midwife...
Oh my gosh!
Isn't that crazy?
Oh my gosh, yes. Did your midwife have privileges in any hospital, or was she there kind of as a support?
She was there as a support, but definitely directed things. I don't think in Israel that you can kind of like have privileges. Like, I don't know if it works that way. She basically acted as a doula once we got there. So we're driving, and she calls the head of the hospital. It's called St. Joseph's. And she says, you know, we're in the middle of one of the most violent periods right now, and we're driving as a hair-covering Jew from the West Bank into this hospital. And the amazing nun who runs the hospital said, it's safe, you can come here, it's totally safe. So we get into that hospital, and the first thing I said is like, I want an epidural. I literally told my midwife, please tell them on the phone to prepare. Like, nobody knows how to advocate for themselves in a hospital better than me. I have had chronic illness my whole life, and I know how to show up in a hospital. So I thought in preparing for my birth that it wouldn't be good for me to be in a hospital because I have a lot of trauma from my time in a hospital. But this ended up being the most healing experience. Being in this hospital, I felt so cared for. The nurses, I could cry. They were so deeply supportive and present for me. The NICU where my son was, I felt literally, they were so good to me. I felt that his NICU stay was a blessing because I had such an incredible experience with the nurses and the doctors at the NICU. And what started as like a pretty horrific experience for me in my birth, just like 2 days of nonstop pain, became really healing, being in that hospital, speaking bad Arabic, my husband trying to translate Arabic to English. Like,
Wow.
wow. It was wild. It was wild.
That is such a cool thing to hear.
It was so wild.
Giving birth in a Palestinian hospital. Did they give you problems getting over the border?
Okay, so this Palestinian hospital is in Israel. So technically, Israeli citizens can go and
Mm,
Palestinian Israelis can go. So that
mm.
wasn't an issue, but it was a really like incredible cultural experience to be treated by Christian Palestinian doctors and Arab Palestinian doctors and to kind of have this chance to peek into their lives and them into our life, you know, on the side of learning how to breastfeed or understanding what was happening to my son in the NICU. We would whisper questions like, why does some of the women cover their hair this way and some of them cover this way? Or, you know, what does it mean that your husband wears a hat and not a kippah? So it was like this really powerful cultural exchange happening during one of the most vulnerable moments of our lives.
Wow. And that is the beauty of healthcare.
Yes.
You know, as a nurse, I have to care for everyone because everyone is a human being, regardless of any choices that they've made in their life, free of judgment.
Yes.
And we have this in Israel all the time with the huge cultural mix of so many different religions and philosophies and ethnicities all mixing together and all just joining in unity to give people medical care. So
Yes.
this is like a beautiful example of that.
Yes, I felt that, and I felt the nurses had that in mind. I would say, like, the one part of my birth story that I wish everyone knew or I wish I had heard was I was pushing for a long time without guidance, and that really wasn't working for me. Obviously, I'm sure for many people that's great, but I needed directed pushing, and it was transformative. This doctor came in, literally like no introduction, but I didn't care. I needed to get this baby out. It had been so long. He just pushed his hand up there and looked at me and he said, "You're doing a bad job pushing." And I'm going to show you what to do. And I was like, yes, this is what I need. He was so cocky, but it was great. And he would say, I had been pushing before, like the difference between black and white. And he had a variance of 1,000. He said, you're pushing 782 and I want you to push 781. Push down a little more, to the left a little more. Like it was so guided and specific. And I loved that clarity of direction. And once I had that, it was wonderful. That was amazing having that level of like guidance pushing. I really liked. I'm curious, is that like typical?
I think that there are different schools of thought, and I feel like there are a lot of strong opinions around that. And I find that the patient needs to decide for themselves, the birther needs to decide for themselves what is working best for them. And
Yeah.
it's important to keep an open mind. So clearly that's the way that worked for you. And I'll have
Yes.
patients that are pushing in one way and I maybe are not being very effective with their pushing, and I will offer them another way and we'll see what works better for them.
You're amazing. Anyone who births with you is so lucky.
Oh, thank you. That's very sweet. I think a lot of, birth workers are really incredible.
Yeah.
And I'm happy that you had good birth workers. Now, when you were pushing, when you were in labor, did you have any hints that your baby was going to have to go to the NICU?
I think if I had any cognitive capabilities I might have, I was so spent and such a mess that I was not tapped into that. Um,
The staff didn't tell you that there's a possibility.
no, I knew that they were like, you need to push this baby out because like some oxygen levels were
Mm-hmm.
decreasing. This is when I would like pull my husband in to be like, wait, what happened? I like
Mm-hmm.
don't really remember.
Mm-hmm.
But it had also I had been in labor and my waters broken for 3 days. So
Mm-hmm.
I think also I was 3 weeks early. and he had been measuring small, very small, the whole pregnancy. So I think all those combined factors, my sister's a NICU nurse, and she said, look, like, basically he was on a CPAP for 48 hours, and that was all.
So he just had a little bit of, he needed some help with breathing.
Yes, this was the most memorable moment of my birth. The baby comes out, and he's whisked next to me, and there are 3 doctors standing there. And I was in shock, and my husband was standing next to the baby. And I said, what's going on? My husband said, the baby's having a hard time breathing. So beautiful. And the doctor said, he's not having a hard time. He's working very hard. And it just, like, that was such a life-changing way to think about things. Like, he's just working really hard. Like, I didn't struggle in my labor. I just worked really hard. This is such a beautiful way to think about all of our work in this world. Like, he's just working really hard. He's not struggling, Yessie. He's working really hard.
Wow.
So beautiful.
And from a medical perspective, that's so accurate. That's really so accurate, because it sounds like, it was TTN, which is called transient tachypnea of the neonate, which is basically, tachypnea means fast breathing. So it's a signal that the baby is working really hard to breathe, and the response to that is breathing extra fast. So that's medically so accurate too, but the messaging, the little change of words is really, I can see how that can be so much more encouraging and beautiful. He was working hard.
He was working hard. I'm so proud of him. He's so beautiful.
Yeah, he was determined.
He was so determined, and he did great. And I have to say, like, I don't know, having him there was a real blessing. And I think now, like, that Hashem really sent that message through me that said, like, you need to go to the hospital because he needed care. And so it helped me shift my thinking from, okay, I failed at a home birth, to I succeeded in bringing my son where, like, he was supposed to be. And he was supposed to be at this Palestinian hospital in the middle of a war in the NICU
wow.
with no kosher food.
Oh my gosh. Oh my gosh. In Israel, of all places, with no kosher food.
Oh my God, I know. It was on Shavuos, and so everything was closed, and the Palestinian doctors kept being like, just call and order. We'll reimburse you for whatever you order. We're like, everywhere is closed, brother.
So right after the birth, was he able to hang with you for a little, or did they kind of just whisk him emergently to the NICU?
This was an interesting moment. They put him on me for maybe 2 seconds. I think almost felt like a formality. Like, we've got to put him on her, and then we're going to take him over to the station to help him breathe. And afterwards, I heard my care provider say, kind of pissed off, like, how the heck did they do that? Like, if they could have, because they weighed him also. She said if they could have weighed him, they could have waited for that and given the mother a minute to be with the baby. And it was really interesting because I did not feel that. I felt fine about what had happened. And it was an interesting moment where I felt like it wasn't her place to, like, analyze whether it was good or bad. And I felt like it was fine,
Well, certainly not to do it in front of you.
Right. It's like, okay, let's say someone had a C-section and it wasn't necessary, but they have this great narrative about it. So you don't need to tell them that maybe the provider did something that was unnecessary if they have a good narrative.
So right. You're so right. And I'm faced with that dilemma. Sometimes, on occasion, there's a provider that is not following the gold standard of care. And I never, ever make a patient feel distrust in their provider. They need to feel confident in their provider. Yes. There's no switching providers right now, and I can do what I can do in order to ensure that they get the best standard of care. But, birth is not black and white. And like you said, you don't want to make the patient start questioning things about their provider and develop that level of distrust. After the fact, if they have questions, then they can discuss it with their provider or whoever else. But yes, that's really, really important. So I'm sorry you had that.
Yeah, and it's a really high level that you're talking about because it means letting go of or subverting like a certain level of truth, right? Like, well, the truth is this should happen. For a higher level of truth, which is that this is what is happening, and how can we, just hold space for that being okay?
Yeah. So I think that it's amazing that your birth completely veered off the path that you were expecting it to take. And it was not easy to be in labor for so long, to have that pain for so long, to have that exhaustion for so long, to have your baby be born and need to go to the NICU to help his hard work of breathing. And yet you came out with positive feelings about the whole
Yes.
thing.
That was very important to me. I've listened to many a birth story. I've listened to your podcast, and I watch all of your stories. And I
Thank
feel
you.
like the greatest thing I've learned is that so much about it is our perspective about it. And, you could have a home birth or a hospital birth, C-section. It's really about like the framing. And I think that was enabled because I received loving care at the hospital. I received such loving care. And I just felt so attended to and so cared for, and I felt really trusting in my providers, and it was incredible. It was an incredible hospital experience, and really, as I said, a tikkun, a healing for, hospitals can be really traumatic places and not a place where full beings are loved and held. And I think the birthing ward is a special place to heal those who have had hard hospital experiences and has that potential to heal that hospital trauma.
Yes, it has the potential, I think, to go either way, to either extremes. And it's so beautiful to hear that it did this for you. And I just wanted to backtrack when you said your baby got CPAP, just from a technical standpoint, to explain what CPAP is. CPAP is basically when the baby takes a breath, it just forces extra pressure, extra air into the baby's lungs. So it's kind of like just an assistance to help his hard work of breathing. So it's not actually, giving him breaths or anything like that. It's just allowing him to take in extra air.
That's helpful to know. I did not know that.
Yeah. And that way he has to work less hard and he can conserve energy that way.
Now I know. I really am glad. This is very educational for me.
Yeah. Yeah.
Wow, what a miracle.
Yeah. So then you went home. You were discharged.
Yes. It's hard. I wish I could paint a brighter picture of birth and postpartum, but I think I just have to be honest about my experience and trust that Hashem will bring this to the right ears who need to hear this. But I had a very challenging emotional postpartum. I had a wonderful physical postpartum. I tore in every possible direction, and I did not hurt at all. I don't know why. Thank Hashem, my body felt fine. And emotionally, I was really a mess. And I was very anxious. I did not have any depressive experiences, but I was filled with anxiety. It was not the kind of anxiety that you can meditate through. It was not the kind of anxiety you can take a shower and it passes. It was like in my body. And it was so heavy and so intense. And I'm really good at taking care of myself and making sure I get my needs met. So I quickly, very quickly, made an appointment with a psychiatrist, made an appointment with a doctor, and just said, I don't want to suffer. I don't want to suffer. And honestly, I'd been putting off taking low-dose anxiety medications for years. I had been facing it like the choice to take anti-anxiety medications always felt shameful. And I know how silly that sounds, but it did. It felt like, I'm not strong enough. I don't have the skills. I didn't meditate enough today. And I'm just so thankful for the postpartum I had because it felt like death at the time, but it was like momish a birth of me as the person I was supposed to be, because that straw that broke the camel's back of postpartum anxiety helped me get on anxiety medications, and I'm like the happiest mom I've ever met now.
Wow.
I love it now.
Do you think that part of the trigger for you actually finally getting that help was that now you also had a child that you were responsible for and you wanted the best for?
Yeah, I think that sounds amazing, and I wish that was the reason, but I think it just felt so bad. I just felt so bad, and I was not functioning. Like, I just, getting through the day was so hard. And it's funny, I can't even think of how or why now, because it was so physical and visceral. It wasn't like I was having some bad thoughts about him or anything. I just, like, my body was really sick with anxiety, and it was probably triggered by hormones and, compounded on my existing, like, low level constant anxiety. Like, hello, Ashkenazi Jew, like, very anxious. But now I look, I'm like the proselytizer of taking these type of, SSRIs, low dose anxiety medications, because I just, why did I suffer for so long? It was like really a blessing in my postpartum to get these, but I feel better than I've ever felt. I have less anxiety than I've ever felt. I didn't realize how hard I was working to just feel okay. And now I feel wonderful, and I don't wake up to a constant mental stress chatter. I just wake up.
And birth is known, the postpartum period is known to awaken and to trigger some dormant stress and anxiety that's there, like you said, just like a lower level anxiety. I think most mothers experience what I call mama bear syndrome. I've seen it referred to that since, but I coined the term myself, like just in my head, also. So I guess there's some other brilliant minds out there like me. So I think it comes from evolutionary sources of you want to protect your offspring. It's a natural reaction of any
Totally.
mammal, of any human. And I remember having my first baby. I went to my parents' house and I got up in the middle of the night and woke up my father and said, are the smoke detectors working?
Yes.
Stupid random things that just popped into my head. So I think that, like you said, hormonally, I suspect that there's probably some component of triggering a certain level of anxiety for the well-being of your offspring. And this is, again, so hypothetical, like this is what my theory is, but my theory is it can propel a lot of other dormant anxiety that's already been there.
Yeah. I think for me, because there is so much stigma and shame around taking medicine, I feel like I need to compensate by being really loud and proud about it and really like normalizing. I'm really grateful to live in a community that's super real. And I was just surrounded by tons of young mothers who were all honest about what they had been through. Many of them had taken medicine, and that's what I needed. And I'm so grateful to my, like, community.
Tribe.
Yeah, my tribe. Like, I really have a tribe here. And it's such a blessing. Like, I think about people who give birth kind of anonymously in cities, and they don't know their neighbors and how hard that is. And here, like, I had a call the other day at work and I didn't have childcare, so I just brought Lev to my neighbor, and how much that changed the landscape of my postpartum experience. And honestly, how transformative taking medicine is. Like, geez Louise, I feel so much better.
It's priceless to have a community, to be living in a supportive community. There's nothing like it out there, and as evidenced by your experiences, had tremendous impact on helping you get better.
Yes. It took so many women telling me that they had been through the same thing. It took so many daily reminders that it was okay to take medicine for me to be brave enough to use this tool that I had been neglecting. And now that I have this tool, every other tool in my tool bag is more accessible. Like meditation is more accessible and therapy is more helpful. But it really took the neighbor to my right and to my left and above and below to all tell me that it was okay, and to talk about the dosages they were on and talk about psychiatrists they had used. And, that level of normalizing is what I needed to be brave enough to be on medication.
Do you think that you were resistant to it before because somehow it made you feel deficient in your worth?
Totally. Totally. I don't know. It's so funny. Like, when I spoke to the psychiatrist, like, I was such a mess. I was just so unwell. And thank God he was incredible. I recommend him to everyone. And he said to me, in 6 weeks, you're going to be the least anxious you've ever felt in your life. And I was crying and I said, like, I don't believe you, but thanks for saying that. And 6 weeks later, I texted him and I said, I never thought I could be like this relaxed. And I don't feel numb. And, the medicine I'm on makes you gain weight. And I said, I'm really fat and I'm really happy.
That's a really great way to put it.
Yeah, I'm fat and happy.
And just for the record, some medications, I think the ones that work really well on that work for a majority of the population because it is a lot of trial and error for people.
Exactly.
Genetically different people metabolize different medications better than others. And, some of these medications that make you gain weight, they're kind of the first go-tos because they're so effective among a lot of people. But for people that are resisting just because of that one reason, there are medications you can go on that will not make you gain weight as well.
100%.
I think that you're so smart to prioritize one over the other.
Yeah. If down the line I'm in a place where I'm ready to shift medications to something that's, this one says you will gain weight. Most of them don't, right? They have other side effects. Then I will. But right now, just like being this happy mom that sleeps well and just like can be in my life and not in thinking about my life, it's just worth anything to me. I'm so honestly so grateful to talk about this. It's the first time I've spoken about it and it just feels so good. And I'm actually surprised at how positive my experience was. Like, I thought I would feel more negative about it. But I think, having him now, he's 5.5 months old. We just sleep trained him. It's like life changer. His name's Lev Matanya. He was born on Shavuos. I wanted to name him Torah. My husband said no.
Have you ever heard of the name Sinai? There's a name Sinai
exactly.
too.
I wanted to name him Sinai, but there was another little boy named Sinai like the week before, so so we chose Lev, and it's perfect. He's super adin and sweet and smiley.
Oh, that's so nice. I didn't have what you have with my second, where I was living in a city with broken up, fragmented neighbors. And I didn't have that beautiful support. And I see my neighbors who are having their first and second little babies, and they have that support, and they're in and out of each other's houses and helping out. And It is priceless. It is priceless to have those social supports.
It's totally transformational for your postpartum and life experience. And I think birth is so important, and I focused a lot on birth. And, it's whatever, it's maximum 3 days, 4 days. And so that postpartum that lasts for months is equally important, and so important to invest time in it. And I think, all the work we do as people serves us as moms. So the work I did as a person to learn how to prioritize my needs and take care of myself was so valuable as a mom, right? And, I'm a big advocate. Everyone's should do their thing. But, we waited 4 years. So my husband and I have a huge amount of skills and a huge amount of, relational strength that really shined during a time when we needed that strength, when I was anxious every day and a mess and healing. And, yeah.
It's so beautiful to hear that things are so nice now. And you really had a lot of... You really had a lot of wrenches thrown into this whole entire journey of becoming a mother to Lev from the start of your pregnancy.
Oh my God. Yes, yes. It was very intense and hard, and I'm at the sweet
That's
spot now where I've got childcare and he's sleep trained, and it's just a lot more enjoyable for me. And I think initially there was a lot of shame in admitting that I didn't really like the newborn period. And even before I had a baby, I told my sister I know I won't like the newborn period. Like, I love kids. I love a 13-year-old girl. Like, everybody else hates that stage. I love it. But like, this little blob that didn't have much interactivity and didn't have much sleep regularity was very hard. I always said, like, Lev, you're so anxiously attached. Like, you're not really respecting my boundaries. Like, my little newborn. And now we're starting to build some structure to life, which feels great. So for any new postpartum moms, it's about to get much easier.
Yes, it's so important for people to know that. I also had a hard time. I didn't realize when my first was a newborn that this will pass. It was kind of, I was so entrenched in the day
Yes.
to day, minute to minute tasks that I had to get through. And like you said, one day she was just sleeping 12 hours and taking two naps in the middle of the day.
Yes.
And I was like, oh my gosh, I can resume life a lot and be
Yes.
happy and enjoy it. Yes, yes. And some people love the newborn stage, and some people are totally fine with the whole attachment parenting thing and have their kid Velcro to them and power
Yeah.
to them. And I was
Yes.
never like that. And I own it. Like like that's me, and
Yes.
you seem to also. So I'm
Yes.
so happy to hear that you're in this good place. I did see snippets of your story, and I didn't know the details of your birth story until now, but I did see snippets of you telling us how it was difficult and you had a lot of difficult experiences. And I didn't know if it was emotional, if it was physical.
Mm-hmm.
Um, and I'm so happy that you're in such a good, beautiful mommy spot. It's so priceless.
It's so priceless, and I'm really grateful. Like, I really haven't shared this, and I think it's just a testament to you as a person and the safety that people feel with you. That, like, I just spent 50 minutes sharing about my birth story. That really I thought was an area that I did never wanted to revisit because it was so heavy, and so I'm just so grateful for the space to just chat about it.
Oh my gosh, thank you. That's so beautiful to hear. And I hope that this gives you some form of helps transform your trauma into
Yeah.
purpose where you can be vehicle to help other people and to give them that last push to go get help, to go to a psychiatrist, to go to a therapist, because this is
Yes.
so common.
It's so common, and I see so many women struggling so much with anxiety, and I want to like offer this to them, but obviously everyone has their journey, and what you just said is like the greatest summary of, like, if my birth had a name, it would be turning trauma into resilience or turning trauma into purpose. And just being on the other side and revisiting her and going to tell her it gets better. You get through it. He starts sleeping. Your body heals. Your mind heals. I take care of you. I take care of you over and over again is so healing to go revisit that scared postpartum mama and tell her that, like, it did get better and I'm here and we made it.
That's beautiful. That's beautiful. Thank you so much,
I love
Simcha.
you.
Oh,
You're
stop. Thank you. Thank
so nice.
you. Thank you. I appreciate it. It really gives me the encouragement to keep doing this when I hear people like you, benefit, and I hear people like you brave enough to tell your story. It's not easy, and it's so beautiful, and it's so important for other mothers to hear and mothers to be and those planning on becoming a mother. So,
Yes.
or those that have not had this experience themselves, and this is important, but have family or friends that are experiencing this, and to know that it's essential to validate their experience
Yeah.
and never to discount that this is real. They really are feeling this way and suffering. I think that the support like you got, being able to, someone who's struggling, being able to receive that support from friends and family is probably also a huge, important component to healing.
Yes. Yes. Oh my gosh. It's such a nice, like, I'll just end with one idea that's probably a little controversial, but I thought it was incredible. Coming from this world of like the holiest birth is a home birth. And if that's your birth, then that's wonderful. But after the birth, I shared a tiny bit with a friend, blonde hair, wears glasses, has like 5 kids, and she's just a real talker. And I told her that, I always thought that getting an epidural was like really bad and really a failure. And she said that the most empowering births that she had were epidural births, and that while many people feel really empowered by home births, for her, she felt like it was a gift and a sign that Mashiach's coming, that epidurals exist, because the sin of Chava is what we like suffer for. And she's like, hey, we have a way to reduce that pain. So what bigger sign that the future is female and Mashiach is coming than that we can have, somewhat pain-free childbirths.
Yes. And you know who I heard that idea from? Are you familiar with Rebbetzin Tzipora Heller?
Oh my gosh, I love her, but it's not where I heard it from.
Well, I mean, again, just like the Mama Bear syndrome, I'm sure that, there are other brilliant minds like hers, but that's what she says. In the same way with, Adam's Chait, and we're not going to make our earning parnasa harder than we have to. The same way, if somebody wants an epidural, they don't have to suffer more than they need to. And it's so beautiful that we have that option. And I think even more beautiful that women can choose.
Yes.
That women are not forced into one way or another, because that used to be it before there were any options of analgesia and anesthesia. Then they just had to get through the birth. And at one point, when there were options for it, women were forced to take them. They didn't have a choice. They went to the hospital and the doctors just put it on them. Yeah. So they were just told that this is what you have to do. And today, it's so beautiful that people have that option and have that choice. And that's empowering in and of itself. So that's beautiful. I don't think that's controversial one bit. I think that's...
Yeah?
I think that's such a lovely, beautiful thought. I
love it. It's such a de-shaming of epidural. This is from Hashem. He's reducing the chet. It's incredible.
It is. It really is. Yes. Thank you again, Simcha. I wanted to just one more time let our audience know that they can find you on Gentle Jew. It's at Gentle Jew on Instagram. I will put the link in the episode show notes, and anyone who can relate to the things that you've said would certainly stand to gain from following you on Instagram if you have Instagram. And thanks again, Simcha.
Yeah, and thank you for just your wisdom and your expertise and holding so much space for me.
It's a pleasure. It's an honor. Thank you.
Thanks for tuning into the Happy Birthday Podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to this show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.